Good morning, everybody. So I'm Bob Gillum, the Executive Director of the Water Institute, and it's my great pleasure to welcome you to the symposium today. The Water Institute has over 140 members that are faculty members at the University of Waterloo, and close to a third of them are registered for the symposium, so thanks to our membership for their support and for being here. There are about 400 graduate students registered or signed up in the Associated Graduate Student Organization, SWIGS, and they're very well represented here, so thank you very much to the graduate students for coming and welcome. The annual symposium is one of the benefits of membership for external partners. We have over 70 external partners. Quite a number of them are here today, so thank you for your interest and for your continuing support. And we'd like to encourage you to meet the faculty members while you're here, take advantage of the opportunity to learn more about the university and particularly the Water Institute. So welcome to all those groups, and if you don't belong to any of those three groups, you're welcome in any case, particularly if you paid your registration fee. So it was suggested that I cover some housekeeping items. One of the items is what to do in the case of emergency. If there's an emergency or an alarm bell, then you exit the back doors, exit the building at the closest safe exit, and then make your way to the assembly area. You can't go to your car and go home. You have to go to the assembly area, which is the green, the grassy area between the Davis Center and the chemistry building out in that direction. Other housekeeping items, let me see. Yes, we have washrooms. If you go out these doors, follow the curving wall to your left. The washrooms will be on your right. Please silence your cell phones, of course. And this Institute staff and students will be circulating, and they'll be more than happy to help you with any questions or guidance that you might need. It was suggested that I give a bit of an overview of the program, and it seems rather self-explanatory when you read it. On the other hand, apparently we did lose a few people last year. So I'll go quickly over the program. The first plenary session and the first technical session is in this room, so you are currently in the right location. Following the initial plenary session, there'll be a coffee break. Those interested in the cold regions program will come back to this room. Those interested in water sustainability in the Waterloo region will go to room 1302, which is just around that curving wall that I mentioned earlier. Now, this is the hard part. When the co-sessions are over, we go to another building. That's the Math 3 building. If you go out these doors, turn to the right, go out those doors, turn to your left and walk down the street. There's an overpass, and on your right, the overpass goes into Math 3. So on your right will be the Math 3 building. The posters, student posters are set up there, and lunch will be served in the foyer of the Math 3 building. And everyone returns to this building at 1:30 after, I believe it's 1:30, after lunch. One of the highlights of the program are the 3-minute theses, so we'd like you all to be back at 1:30. Don't miss the 3-minute thesis presentations. And then there are 2 more breakout sessions, the same rooms as this morning. And following those breakout sessions, there's coffee, and that's actually the end of the official program of the symposium. However, we're hoping that you will all attend the distinguished lecture, which will be back in Math 3, And we're very happy to have Sunita Narain with us this morning, who is our distinguished lecturer. So welcome. Sunita just arrived yesterday from Delhi. So that's all my comments on the program. Again, the students and staff will be happy to help you out if you're having difficulty finding your way around. A number of thank yous. The committee that helped to organize this program included Heidi Swanson from Professor in Biology, Rich Patrone, Geography and Environmental Management, Bruce McVicker from Civil and Environmental Engineering, our External Partners Program representative from Stantec, Steve Brown, our graduate student representative, Maricor Arlos, and of course the staff of the Water Institute. Now, the committee established the structure of the program and identified the main topic areas, but the actual implementation was left to the staff of the Water Institute. So Grant Murphy, where's Grant? I don't see Grant at the moment. Took care of much of the communication and promotion of the Institute and interacted with our industrial partners. Merrell-Ann Hrudey, there's no job too small for Merrell-Ann, and that's to say that Merrell-Ann really likes to take care of details, and we had a bushel full of details to be taken care of, as you can imagine. So Merrell-Ann's been particularly cheerful these last few days as she had all these details to take care of. And this was all managed by Kevin Beamer, who is, where's Merrell-Ann, by the way? Oh, okay. Well, our staff is very busy. This was all managed, of course, by Kevin Beamer, who spent many, many hours filling out the program and directing the other aspects in preparation for today. So, if you would, oh yes, and our speakers. Where would we be without our speakers? So a number of the speakers do not have a formal affiliation with Waterloo. Quite a number of them have traveled quite a distance, some of them at the front table here, to be with us today. So please join me in thanking all those who have contributed to organizing today, and particularly our speakers from away. So that's the end of my comments, and I wish you all an enjoyable, informative, and inspiring day. And before proceeding to the next item in the program, I would like to acknowledge that we are meeting here today on the Haldeman Tract, the traditional territory of the Haudenosaunee and Anishinaabe people. And now I'd like to call on Susan Elliott, professor in the Department of Geography and Environmental Management, to chair our opening session. Susan.
Good. I'm good to go. I have this wonderful wireless mic on. It's great to see so many familiar faces here this morning, and I'm really pleased and proud to be facilitating this session. As Bob said, I'm a professor in geography and environmental management here, and I'm a medical geographer by training, and usually when I say that, people kind of screw up their faces and say, huh? And so I do a lot of research on water and health, and so I'm a very active member of the Water Institute, very pleased the Water Institute is here and supporting the work that we do. And I started working on water and health about 10 or so years ago. And in doing that work over the last decade or so, there are three important lessons that I've learned. The first is that it's all about the people. You have to listen to the local people. So when we walk into communities in developing parts of the world or parts of the world that don't have access to water or sanitation, and we think we know best, it's completely wrong. That's the completely wrong attitude to walk into those communities with. The analogy I often use is, many of you know that my husband is an Arctic archaeologist who was on the Franklin expedition last summer. So if you don't know, Sir John Franklin's ships sailed to try to find the Northwest Passage about 150 years ago. Ships went down, lost all the crew, lost Franklin, and for 150 years they've been looking for these ships. So for the last 6 summers, my husband goes off and lives on an icebreaker in the Arctic and plays around and tries to find Franklin's ships. I've actually never seen my husband on our wedding anniversary or even talked to him on our wedding anniversary because he's always been off looking for the Franklin ships. Last summer, guess what? He helped them find the Franklin ship. They found the Erebus. And you know what? It was exactly where the Inuit said it was all along. So if they had just listened to the Inuit, I would have actually seen my husband on our wedding anniversary for the last 6 summers. And the government wouldn't have had to spend hundreds of millions of dollars. So a really important message to me was the importance of listening to the local communities. When we started working in our community, which is Soma in Kenya on the shores of Lake Victoria, over 10 years ago, the first thing we realized, was to talk to the community. How do you work as a community? How do you get along as a community? What's important to you as a community? What are your big challenges? And in fact, their biggest challenges were not water, even though we thought they were water, and there was no water or sanitation. They had other challenges that they were dealing with. And so that's where we started, by talking to the community. And out of that came 1 master's thesis and 2 peer-reviewed publications. The second message is the link between empowerment and sustainability. Like many water researchers or development researchers, development people, we walk into a community and the first thing we do is a CAP study, right? Knowledge, attitudes, practices. We do a CAP study. What's the knowledge about water and sanitation? What are the attitudes? What are people doing about it? It occurred to me sort of halfway through that process that we need to put an E on CAP. So I actually started calling it CAPE. Because once we learn about knowledge, attitudes, and practices, we have to empower that local community to actually solve the problem. And so we worked with that community. We didn't do it for them. We worked with that community to help them develop a water committee that met on a regular basis and had a chairman, and they took minutes, and they negotiated with the local water company. And in October of 2013, that community actually had water, access to safe water and sanitation, as a result of our research, but primarily as a result of what they did together as a community. So it was knowledge, attitudes, practices, empowerment. And out of that work came 5 peer-reviewed publications and a PhD dissertation. The third take-home message for me from working in water health for the past decade or so is related to the links between science and policy. And this is really important for me. And it's also really, really hard. Once you start involving people in these scientific questions, it gets really complex. I remember when Chad Gaffield was made the president of SSHRC, the Social Sciences and Humanities Research Council of Canada, and he made a speech that said, we always talk about the hard and soft sciences. We talk about NSERC and the hard sciences, water quality testing, all that really hard science stuff, and we talk about social sciences as the soft sciences, asking very different kinds of questions. And in his speech, not to denigrate anything that basic scientists or natural scientists do, but he said, you know what, it's the social scientists who ask the really hard questions. We are the hard scientists. How do you actually translate science into policy? How do you actually translate knowledge into action? It's very, very difficult. Try and get a policymaker on the phone. Try and get a meeting with a federal minister of health or environment or anything else. It's very, very difficult. But it's important. It's important if we don't want to just study problems and we want to help solve problems. And so one of the take-home messages for me out of our research in this particular community is we produce really good graduate students, we produce excellent science, and we produce lots of peer-reviewed publications. That makes the university happy. But we also ended up with a result where we had safe water and sanitation in a community that didn't have it before. And that makes me as a researcher very happy. So hopefully we're going to hear some really good messages throughout this session this morning, and it's my tremendous pleasure to introduce our first speaker, who is Irving Leblanc, whose nickname is Bing, and I haven't had a chance to ask him yet why his nickname is Bing. So if you get a chance to ask a question at the end of the session, you should ask him that question. What we're going to do is we're going to have all of our speakers come up. They're going to speak for about 15, 16 minutes. I will give them a high five sign when they're at about 15 minutes so they know they're getting close to the end of their presentation. We'll take a couple of minutes for questions of clarification, but we'll wait until all the speakers have finished before we enter into a major discussion. So after the last speaker's done, I'll ask them to come and sit in our fancy podium that kind of looks like the agenda. The only thing missing is Steve Paikin, and we'll have a nice conversation about the issues that are raised. So Bing is an Adawa from the Wik-Wik-Among unceded Indian Reserve located on Manitoulin Island, and he's also a Waterloo grad. So we're welcoming back an alum. He obtained his Bachelor of Applied Science in Civil Engineering from UWaterloo in 1971, and he's a professional engineer and a member of the Professional Engineers of Ontario. He's currently the Special Advisor for Housing, Infrastructure, and Emergency Issues Management for Safe, Secure, and Sustainable Communities at the Assembly of First Nations. And his job there is to represent the AFN on the various initiatives and committees related to housing, infrastructure, water, wastewater, source water protection, and emergency management issues. That sounds like a very big job. He's also on the board of the Canadian Water Network and UBC's RAZO WaterNet. So welcome, Bing.
Okay. Thank you very much, Susan, for those kind words. Yes, I am class of 71, which means that you stay in the profession, you can stay in it for quite a while, quite a long time, if you're doing it right, I guess. First, I'd like to acknowledge that we are in the territory of the Six Nations of the Grand River Territory, and we always acknowledge whose territory we are in. And I also want to thank the Water Institute for inviting Assembly First Nations to participate in this workshop or seminar, I guess. My presentation is a lot of information, I think really more targeted to providing a discussion piece later on. So it kind of straddles all the areas that I'm involved in, and since joining the Assembly of First Nations in 2007, I've been involved in a lot of activities. Susan mentioned, some of the water deficiencies across the country, where water scarcity is a big problem. Some days, some places you have too much. Right now, one of our communities on James Bay, Kashetwan First Nation, has been evacuated completely and that's been happening for the last 4 years in a row. And this community goes through this every year, and certainly imploring the government to do something about it. They wanted to be relocated many years ago, but the government decided to put them in the floodplain. That's where we go through every year. So anyway, I'll get on to my presentation. And okay. Okay, thank you. I was mentioning to a colleague here, Merrell-Ann, this morning that I've really never done a specific topic on water security for First Nations. It's really, we do it, essentially all of the aspects that deal with water security is something that we deal with all the time. We've never really put it into one basket and called it water security. So I had to look up a definition and I found one on UN Water. Water security defined as the capacity of a population to safeguard sustainable access to adequate quantities of acceptable quality water for sustaining livelihoods. And that's a big impact to our communities. Human well-being and socioeconomic development. One of the other areas, files I've taken on, is the social determinants of health. And it certainly comes into picture in a lot of that, how water, lack of access to water impacts human health, First Nations health, issues that lead to the health issues we face, diabetes, obesity, and all that can be can be linked to lack of access to water. Socioeconomic development, but the opportunities for First Nations to engage in the wealth creation of this country and being able to participate and attract economic development through make sure that you have the water required if you need those in that those projects. Ensuring protection against waterborne pollution and water-related disasters, which we're talking about the floods and all the others that are happening on a regular basis. Waterborne pollution. I'll mention later that the you know the last H1N1 event we had a few years ago. Some of the remote communities were more impacted than the norm. Other areas of the country. A lot of it was because of lack of access to water. Their water system was not functioning. They did not have water in the schools where the kids could wash their hands and that kind of stuff, or even in the house where there was not water supplies, and the contamination kept on going. So there was a much higher incidence of H1N1. And preserving ecosystems in a climate of peace and political stability. And those are some of the larger areas that we're working on at 70 First Nations. Have another unit at the Assembly called the Environmental Stewardship Unit. They deal with a large picture of forestries, fish habitat, and they look at, looking at working with their neighbors, working with the provinces, working with the feds and all those areas in terms of protecting water for fish habitat. So that's just a bit of a introduction, I guess, into what I try to read into what our issue is today. So we start off with what are the major security issues, and it goes without saying lack of water, wastewater regulations on reserve, and this is really a contentious approach that we're looking at. We don't have any objections to regulations. It is the approach that's being taken. Regulations being developed without First Nations involvement, and the lack of proper consultation when those regulations are being developed. And the biggest part of it is the introducing legislation in the Senate in this case, and there was no resources attached to it. So you're developing a set of regulations, but the government has not identified any resources to implement those regulations. So I think one of the most areas that comes or strikes people right away is the drinking water advisories in First Nation communities. I'll get into some detail later. The water systems themselves, 73% of the water systems on First Nations are in either high or medium risk. That's about 50-50, I guess about 39% are in high risk, but we include the medium risk because we believe that because of the lack of resources attached to maintaining these systems, the medium risk will turn into high risk very quickly. I mentioned H1N1, detection of contaminated waters, the resources that we have in the communities. Sometimes remote communities, they can't send out a sample within the time expected to come back in 24 hours because they're depend on flights or winter roads in the winter time. So trying to get early response. There is technology that we are using, the call alert system, but it's not always that, I think, not as robust, I guess, as sending it to a recognized lab. Our O&M funding, which I mentioned earlier, source water deterioration, big issue again, it's always been with resource development. Not paying attention to what they do with the water, fracking, all the threats that come with it. Emerging contaminants. We do have issues with pharmaceuticals, with the high incidence of disease in many First Nations. There's a lot of drug use, and that finds its way into the water system. A lot of the water systems up north in some communities are kind of a closed loop, where you discharge the wastewater into the same lake that you're taking the water from, and sometimes they've been designed that the inlet and the outlet are not that far apart. I mentioned about resource developments, socioeconomic impacts on lack of water, the ability to attract economic development to your community, be able to attract staff that want to come to work there, and being assured that they're going to have a healthy supply, healthy access to water. And one of the big areas we're facing is the high population growth, overcrowding, and their impact on the water systems. Very quickly, some success stories that have gone on in the past. The Circuit Rider Training Program, which is a hands-on training program that AFN piloted back in 1995. It is now a regular funded program with the government, and that is having experts come into the community on the circuit every 5 or 8 weeks, working with the operators, training them in the operation of their system, training them to learn the regulations, even though they're not applicable, but when they need to write the provincial exams for water treatment, they need to know the regulations. The peer support areas, Aboriginal Water and Wastewater Association was formed back in, again, 95, when a group of First Nation operators got together and determined that First Nations operators needed a peer support system. That's been functioning and very successful in the past years. It's made up of First Nations operators on the board, and they provide that peer support. What happens there is you might want to ask, well, why don't they go to Ontario WHEEL or Ontario Water Works Association meetings? They do go there, but it's not really a peer situation. So these events that the AWAO keeps, they're comfortable, they're with their own groups, they're happy to interact, share stories, share problems. One of the areas that I've been involved in since I joined the AFN is engagement with academia on research. In particular, the first group I was involved with was the Canadian Water Network, and I mainly agreed to sit on the board there. I saw the amount of First Nations research was being conducted, and part of that was, okay, what's happening to that research? Is it earlier I kind of felt that it was research for research's sake. You do the research, then you go on to something else. But I think over the years that I've been involved on the Canadian Water Network, they've moved over into a user-based approach where they're working more with First Nations. And I think this is one of the main messages I would like to present here, is to work with First Nations, and Susan mentioned that. Excuse me. Working with First Nations right from the beginning, in involving them in research, and actually not just having somebody on the project for a short while, but actually engaging with their organizations like AFN, all the other regional organizations. I believe that's the right way to do it. The other group, Reso WaterNet, they actually do research, innovative work on First Nations. They have a pilot project where they're developing a prototype water systems, working with the First Nations on the community. IC impacts, India-Canada impacts. I was asked to join that because there's a First Nations element to it, where they also want to look at issues, solutions for First Nations. One of the things that we realized that in terms of small communities for First Nations, we're talking about maybe 500, 1,000, 2,000 maybe at the most. Small community in India is 20 to 50,000, so we're a bit of a scalability problem there. But it's the same still issues of water access. Since the Walkerton tragedy, the Walkerton Clean Water Center was set up, and part of the recommendations from Justice O'Connor's report was to contain about 15 or so recommendations related to First Nations. So Clean Water Center has been active in working with First Nations in Ontario, developing or providing workshops, albeit at a cost recovery basis, but they've been there for support. Certification of operators. When we first started into this, there might have been maybe about 25% of the operators were certified. Now they're at the high level for essentially leading up to potential water regulation environment. We do acknowledge, I guess, the budget funding water gets from the federal budgets every other year. There's been a significant amount of money there, but the end result is the problem is so huge that it's still not enough. So we keep asking for more. Advocacy efforts, collaborations with NGOs such as Polaris Institute. We're working with them in advocating for water for First Nations, Human Rights Watch, QP, the trade unions, PSAC, other NGOs like Freshwater Alliance. We've been tapping into that, and Idle No More, which has sprung up in the last few years. Essentially, was sprang out of the Bill C-45, I believe, events that the government was taking away protection for waters, and that group grew into a larger advocacy group. What has not worked? Government's approach to legislation, forcing legislation through consultation with First Nations, policies, their own policies without adequate support. They do develop water policies that we are supposed to follow, but there's no water attached to it. No, I'm sorry, there's no funding attached to it. They're tied in with the funding agreements. They're buried in there where the First Nation has to sign the full agreement to get their funding, but they bury these other agreements there where the First Nation has to deliver certain activities, but they're not. But the money doesn't come with it. One of the areas that we keep going back and forth with the Council of Canadians is the bottled water issue. I know they have this program where they're trying to get municipalities off bottled water, and I keep telling them that, yeah, well, for First Nations like you guys live in the urban areas, that is a luxury for you. You know, that's a status symbol. For us, it's a necessity. We don't have water. They depend on the bottled water flowing into the communities at huge cost, rather than dealing with the water issue, utility issue. There's been a dependence on bottled water. So there's been a 2% on program funding. This goes back to 1995, and this impacts water, wastewater, facility management. There's been 2% cap since 1996. Essentially, it's a level funding because you look at the inflation rate and the cost of living and the competition in construction. Essentially, we've been at a level line since that day. And recently, all the organizations have been getting serious funding cuts, cutting back on staff to provide that support. AFN is part of that. So we're doing more with less, or in some cases with nothing. Like myself, I have no funding from Aboriginal Affairs to do the work I used to do on housing, water, emergency issues. So we have to find that within the organizations. Just a little bit of background on the water and wastewater regulations. Currently, there are no regulations on reserve. The only federal regulation that impacts is the Fisheries Act, and that is the habitat, protection of fish habitat. And Environment Canada has in the past laid charges to Aboriginal Affairs and others, First Nation, they take a shotgun approach whenever there's been maybe a major spill of wastewater into a river. So they're more or less the enforcers of that particular Fisheries Act area. The government's approach is to develop and legislate regulations that will be applicable on First Nations. The current approach is that they've put a notice on their website asking for input on the regulation. That is not how we do consultation. We absolutely object to that. Their approach has said, okay, we'll get input from you, and then we'll draft regulations, and then we'll put them on Gazette 1. As you all know, Gazette 1 is the draft regulations, then you can comment on it in the next 60 days or so without any resources, technical resources or knowledgeable resources for us to comment on those regulations. So it's totally in opposition to what we believe is called the free, prior, informed consent on any legislation and policies that are going to involve First Nations. As I mentioned earlier, we do not oppose regulations. We see a need for them, but you have to have the resources to implement them. Some of the things that are buried in the Act is that the feds are devolving all responsibility and liability of water to First Nations, and again, without the adequate resources to do that. Sorry. I mentioned at the start, if you don't have the proper community infrastructure, that essentially limits how the community can operate. It's a major determinant of health to the community. So that's a larger approach, or looking at from a higher picture. This absence can restrict many of the other areas of a community progress, such as attracting economic development, access to basic sanitation. We often look at the Millennium Development Goals, how they apply to First Nations. We still haven't, we're still not there. We still have communities that have to use outhouses and buckets to gather water and bring them to their homes. Adequate water to carry out daily activities. So imagine yourself trying to work on 2 liters of water, bottled water a day. How do you maintain, look after your family, your children who want to go to school? They can't do proper sanitation. That translates into self-esteem issues, where sometimes the kids don't even want to go to school because they don't have a place, haven't bathed. The girls, having basic sanitation, all that impacts on learning outcomes. So there's a lot of outreaching events that happen when you don't have access to safe, adequate supplies of water. Again, hiring people to come into the community. Every chance they get, the people that come into the community, every chance they get, they get out of there, go home for a couple of weeks and come back in. So there's not that, there's limited, I think, support to the community when they're there. So we do appreciate that they're there. I'll just skim through some of these, probably running out of time. As I mentioned, some of the surveys that were done, 32% of household water is unsafe to drink. 73% of the water systems are high, medium risk. 34% of communities still get water by truck from wells or collect from the river, lake, or they go to the water plant to fill up their buckets, their jerry cans. And I mentioned 800 houses on reserve without water service, and there's no water service. You still have to go to the back, to your outhouse, and carry water to your house. The government commissioned a study back in 2011, identified $4.7 billion in need over the next 10 years. We supported that. It at least would give us an order of magnitude of the need that was there. In very basic numbers, we would expect $470 million a year for water for First Nations. We're at $165 million every year. So we're far away from meeting that study needs. The assessment was based on a simple walkthrough. Somebody walked through the system, talked to whoever happened to be there that day, and made an assessment on the system. One of the areas that we're looking at moving into regulations, and the First Nations are going to be expected to take on the management of water and enforce the regulations. We're going to have to go through another round of detailed engineering assessments that my former organization, Ontario First Nations Tech Services Corporation, did back in 2005 and earlier. So these high-level assessments are not really useful for planning purposes. I mentioned this earlier, 73% of the systems are high, medium risk. Wastewater systems, because most of them are lagoons, they fared a little bit better, 14% are high overall risk. But with the wastewater system effluent regulations put into effect by Environment Canada a few years ago, my understanding is that a lot of these lagoons do not meet the requirements for spelled out in that regulation. This is the tallying number that we often refer to, the number of drinking water advisories. As of February this year, 92 communities in Canada, well, outside BC, excluding BC, they have 139 DWAs. Some communities have multiple DWAs. For example, Shoal Lake 40 has 6 wells, and they're all impacted, jeopardized, so there would be 6 DWAs in that community. In last few years, BC took over all of their health programming and then established a First Nations Health Authority, and they've also taken on the role for taking on the water quality. So they report separately. There are 34 drinking water advisories in 30 First Nations, and overall there's 122, or about 20% of all First Nation communities in Canada have some problems with their water that they cannot fully access it. Challenges with the water and wastewater regulation. Obviously, we need the capacity needed. Expert panel identified the resource gap. You have to deal with the resource gap before you can go any further. Downloading of liabilities without proper funding. Inadequate O&M funding. The funding that First Nations get is 80% of the theoretical value of maintaining that system. First Nations have to find the other 20%. And with the majority of quite a few of the First Nations with high unemployment, I really cannot get that out of the users, and the 2% cap I mentioned. Potential remedies. We've always looked at First Nation driven strategies, the First Nation management of water resources, with lawmaking. There's a community right now taking that approach where they are going to say we're going to develop our own laws. It's under Section 35, under jurisdiction rights. So they're looking at that. We'll be looking at that very closely, how that works out. There's been some talk about P3s. How you provide more assets on the ground, either bundling several communities through P3s. That's having its challenges on First Nations, and maybe look at alternative servicing options, partnerships, procurement strategies, working with utility providers to provide that service on a design, build, transfer, or operate and transfer once the First Nation is at a capacity to take that over. Again, looking at innovative and new technologies, remembering, taking in mind that a lot of communities are small, they're remote. Training is a challenge. There's a lot of turnover, problems with recruitment and retention. So those systems have to be robust, have to be easy to operate. And problems that we found in terms of getting replacement parts, you cannot be going overseas to get that part to bring back. So it has to be, again, robust. So innovative new technology, decentralized systems. There's a lot of talk now about decentralized systems. Are centralized systems too expensive for small communities? Is there ways of looking at point of use, point of entry systems? But then how do you deal with the water, the fire supply? So there's a lot of other issues involved with that. And looking at centralized agencies, hub models, such like the Aqua model, band and pulling communities together to provide service to their members. So, Shamigats, thank you again for inviting me to speak. No, too much there. Thank you.
Thanks so much, Irving. Thanks so much, Irving. That was a wonderful foundation. I think in order to have lots of time for discussion, we're going to move on to our second speaker, so you can have a seat back. We'll bring our panelists down to the front when everyone's finished speaking. It's my great pleasure to introduce Steve Hrudey. I'm sure he doesn't realize how awestruck I am to be able to be sitting beside him and introducing him in this session, because I'm thinking that at the break I need to run back to my office and pull out at least one of his books and bring it back and have him autograph it for me, because this is a wonderful experience for me. To me, he's like the quintessential transdisciplinary environment and health researcher, and you will get that sense from his introduction. He's a professor emeritus at the University of Alberta, which, for those of you who don't know what that means, it means typically that we're retired at that point, but I don't think he's very retired. He's a respected international authority, studied and taught extensively about the causes of unsafe drinking water, as well as things that we can do to improve that situation in waterborne disease. He started his career by working on environmental research in Britain, then as an environmental regulator with the government of British Columbia and Environment Canada. So he's that nice science policy bridge. Joined the University of Alberta in 1975, who worked in civil engineering for 13 years and then moved to the Faculty of Medicine. That was in 1988. And then he established an interdisciplinary environmental health program, now the Division of Analytical and Environmental Toxicology, before he retired in 2008, became professor emeritus, but I don't think he's really retired. He's president-elect of the Professional Engineers and Geoscientists of Alberta. And he served on more than 25 expert panels, 8 as chair, including chairing the Royal Society of Canada expert panel on environment and health impacts of the oil sands industry, the Minister Jim Prentice's expert panel on safe drinking water for First Nations in Canada, and on the research advisory panel to the Walkerton Inquiry. So it's my tremendous pleasure to introduce Steve Hrudey. Thanks very much.
Thank you. It's a pleasure to be back here at Waterloo. I feel this is sort of my second academic home. I see a lot of familiar faces in the audience, and it's great to be back. Well, Bing has given you an excellent overview of all the issues that First Nations are facing on the water security front. So I can't, in 20 minutes, go into the detail that he has. I'm going to focus on the safe drinking water element, which is what I know best. Looking at the challenges, the reality is that the majority of First Nations water systems are small, and they're often remotely located, which creates lots of challenges. What kinds of responses? What I'm going to focus in on is the need to focus on the operating aspects. Governments find it easier to sit in air-conditioned offices in Ottawa and sign checks for capital investments, but seem to have struggled with the concept of supporting training and mentoring for operational activities. And so even though, as Bing has pointed out, there's serious shortfalls in the amount of capital funding, there is at least substantial capital funding. But on the operational front, and this was evident when we were doing the expert panel in 2006, there's the view of underfunding of operations, and even so, there's a failure to actually tackle the basic problem of operations. So, at the risk of focusing on a single aspect that might help for one of the many problems that Bing has listed, We believe in work we've been doing that the Drinking Water Safety Plan approach is the correct approach for any regulation that may be coming. Unfortunately, I have to report that after testifying before, I think three Senate panels on the legislation that was passed and one House of Commons panel, when it was evident that from the House of Commons panel that the legislation was going forward, we wrote in on behalf of the Canadian Water Network and suggested a modest little addition to their preamble to point to the benefit of water safety plans because that attaches with it a lot of meaning as to what you're trying to achieve. That was not considered and not implemented. So just to illustrate the issue, and this is a map from the Canadian Census 2006. All the little dots, which might be a little difficult to see on the map, are locations of First Nations reserves in Canada, and you can see that the issue about small and remote is a problem. This is a slide which is probably not as up to date as Bing's data, but from 2007. That 90% of the First Nations communities are 1,000 inhabitants or less. The average number of connections in 2007 was 92 per system, and only about 2/3 of the systems are pipe systems as such. So there obviously are a lot of challenges with these small and remote systems, but it's the operational aspect that I'd like to focus on, and this is drawn largely from our book that we published last June with the American Water Works Association, with the sponsorship of the Canadian Water Network here in Waterloo, Rural Alberta Development Fund, the Walkerton Clean Water Centre, and the National Collaborating Centre for Environmental Health in Vancouver. The book itself is focused on trying to learn from experience, which seems like a sensible thing to do. The basic premise is why learn the hard way? I mean, things have gone wrong in drinking water systems, and that's what we've documented. The reality is that most frontline personnel, whether they're operators, managers, regulators, or public health people, won't experience a major disaster firsthand. That's the wish, at least, and the evidence is that that's normally the case. But it makes sense in order to try and avoid, for those unlucky few who will experience this, to give them the opportunity to live that experience from reading about what happened to others. The logic behind that kind of approach, I give the kind of trivial new car example. If you're buying a new car, say a green Toyota Corolla, before you buy one, you've never seen one, but once you're behind the wheel and driving around, you see them everywhere. And that's just a reflection of the fact that once you get engaged in something, you see the world differently, you notice different things. That's the whole premise of learning through case studies, which is designed to feed directly into what a drinking water safety plan approach is. And in essence, a drinking water safety plan approach is focusing on knowing your own system. And we don't just mean knowing it in the sense of knowing where it is, knowing how to open the door to the facility and flick the switch to turn it on. We mean know it inside out, know all of the quirks, know what challenges it faces, know what limitations it has for dealing with those challenges, and all these things are necessary to feed into an effective operational approach. So the reality is that water outbreaks and problems keep happening, not just on First Nations reserves, but throughout affluent countries, and there's a need to focus on prevention. The case studies offer an opportunity to learn that way. The case studies are intended to be something that could be adapted to local realities. Fortunately, we don't have any First Nations case studies in our book. In order to do what we did with the book, we needed to have a level of detail that was not readily available for many cases, because we wanted to be able to tell the stories from the perspective of the people running the plants. What did they know and when did they know it? It's been our observation that people running water treatment plants don't really want to make their neighbors sick. In particular, if you look at the Walkerton experience, the Cable brothers who were ultimately criminally charged for their misdeeds in that case were long-term residents of that community. It was their friends and neighbors who got sick and died. I don't think that was their intent. So the idea is that if people running systems can be afforded the opportunity to fully understand the consequences of a water system becoming contaminated, they will be less likely to allow that to happen on their watch. So what we encourage to communicate is, could the kinds of things that we've reported happen to your system? Would all of the failures which occurred have been detected by things that you do in your own system? Would your system have responded appropriately to all the signals if they were detected? And ultimately, that's what a drinking water safety plan approach is designed to achieve, is to have people work through that kind of process, anticipating the things that can go wrong, and try and answer some of those questions in advance of things going wrong. So just to make the point that lots of things have gone wrong. I don't have time to go into the details here, but this is a summary of most of the cases that we have in our book. I think I would draw your attention to the year column. You'll notice that they range from the oldest being 1988 to the most recent being 2011. So it's not like these are old-time occurrences. Things keep happening in communities. The other thing I'll draw attention to, and I'm going to focus on the two that are bolded there, Alamosa, Colorado, and Nokia, Finland. In both cases, deaths were involved. So deaths by drinking water contamination were not unique to Walkerton. They have happened elsewhere, and they continue to happen. So Nokia, Finland, had a chance to visit there January a year ago, a small community in northern Finland. They started receiving telephone complaints one day, and the blue and the red dots are just the different days when these telephone complaints started coming in. And the first thing that they failed to do that should be kind of a no-brainer in these circumstances is to plot the location of those complaints. Because if they had, they might have noticed that their waterworks is way off to the right in their system, and the complaints were clustered as shown, and in the middle of those complaints was the wastewater plant. And what turned out to happen, this is the wastewater plant, they had a system of using their treated wastewater for cleaning up within the plant. And one day when the operator was trying to do his cleanup operations, the system was down. He had to do his cleanup. They had an opportunity to connect with the little red bar there to the potable water system. So he connected up his cleanup to the potable water system, and at the end of his cleanup, he forgot to close the valve. And when the wastewater recycling system came back on, it was at higher pressure, and they ended up pumping several hundred cubic meters of treated sewage effluent into the potable water system. That happened for 2 full days before the drinking water people figured out what was wrong. Over 8,000 people got sick and 2 people died. The other case, Alamosa, Colorado, and I just include this picture to sort of show attractive remote location for this community. It was on a high-quality groundwater supply, which had not really shown any evidence of fecal contamination throughout the monitoring period. But like any community water system, they usually need water storage. The high-quality groundwater was stored in this reservoir where you can see the crumbling concrete. It hadn't been cleaned for 20 years because of the failed maintenance. Birds got into the thing. We had a salmonella outbreak that caused 1,300 cases and 1 death. So what does this tell you? Well, to me it says that, yeah, these things are rare, but our typical operator training approaches don't necessarily communicate the right stuff. And so what we've tried to communicate through our focus with the book is the things that the big picture things that somebody needs to be looking at and understand to operate a water system. So we've distilled this into 10 commandments. First being never say never. Contamination can strike any water system. And the test is really how quickly people can recognize trouble and how effectively they can respond to that. I've lost track of the number of times I've talked to people in Canada who say about their own systems, well, Walkerton can never happen to us. Well, of course, the exact circumstances that happen in Walkerton are unlikely to ever be reproduced in exactly those terms anywhere else. But elements of what happened in Walkerton are evident in many small systems in Canada, and I worry about people taking an attitude, well, that could never happen to us. What you want is the attitude of, my God, it could, and how do we keep it from happening? Never underestimate the capacity of fecal materials, human or animal waste, to make water unsafe. In our experience from doing all the research on these outbreaks and so on, that's the biggest single misunderstanding. It's kind of hard to believe that people don't understand that it's fecal waste that makes water unsafe in most cases. And the thing about that is it's everywhere you find people or animals. So name me a place on the planet that doesn't have people or animals. Not too many places where you're trying to provide water systems. So the point is the source of the contamination is always there. The catch is to operate your system so that you don't allow that contamination to make your water system unsafe. And some of the examples that we've captured in the book, it takes surprisingly little fecal waste to make a water system unsafe. Need to learn from experience. So every water system needs to have a capacity to learn from its mistakes and try and get better. That's tough when water systems are just struggling to survive. There's a necessity to recognize when you don't understand what's happening, to admit it, and to seek help. And so Bing has rightfully pointed out that the circuit rider training and the peer support activities in Ontario are a huge advance. You need, no operator knows everything that you might need to know about keeping a water safe. So setting up networks where people can talk to each other and share experiences are critical. Don't overlook the obvious. If you wouldn't eat there, you shouldn't be satisfied with drinking water there. And the thought process behind this, as I recall, during the Walkerton inquiry, we did a tour of a community nearby Walkerton that had very high quality groundwater supply coming up through a pump house and being distributed throughout the town. Their concern was that Ontario had brought in their view, a knee-jerk reaction of requiring chlorination for all water supplies, regardless of quality. And they were arguing that chlorinating this high-quality groundwater supply was going to be a serious problem for them. But what I remember was, watching Justice O'Connor go into this place, and you could only fit 2 people in the pump house at a time. Then I went in afterwards, and the thing was a pigsty. And that's where it kind of struck me. I wouldn't eat my lunch in there, so why would I be confident in drinking water produced in there? It was filthy. Treat water operations like defensive driving. Things will go wrong. You need to be anticipating them and get ready to act. Make sure you understand why you must do regulated things. Lots of cases that we've seen, people are doing stuff that they're told to do, but they don't understand why. If you don't understand why, you're not going to be well prepared for dealing with the problems. Maintain a healthy skepticism about the first explanation of what's wrong. It's natural to go to what may seem to be an obvious explanation, but lots of the cases that we encountered showed that something else was going on, and you need to have a bit of healthy skepticism. Don't let others, your managers, politicians, pin the blame on you. And focusing in on First Nations issues, this is a concern. When we were doing the public hearings, we heard from operators who were saying, well, we're just not getting supported by our councils. And I don't know how you fix that, but the operators have to have an opportunity to be able to document what they think needs to be fixed. Ultimately, we see a need to instill some semblance of pride in people who are water operators, because when you look at it, they are the front line protection of the health of the community. They deserve more respect than they get. So some closing thoughts, coming back to the idea of regulation. More stringent water quality numbers will not ensure safe drinking water. The numbers which existed for Walkerton actually would have done the job if they'd been implemented. It was a failure to do the things we know how to do that cost Walkerton, not that the numbers weren't stringent enough. Regulatory focus on multiple chemicals should not be allowed to distract from the primary risk, which is pathogens. If you've got limited capacity to deal with stuff, make sure the pathogens are dealt with. Any regulation has to focus on achieving competence at all levels. If you can look at it and say it's not going to achieve competence, it's not directed that way, then it's not good regulation. Ultimately, any drinking water system needs to focus on good practice, and that's the drinking water safety plan approach that we're suggesting. So in closing, I'll just point out anybody that's interested in understanding that, AWWA has made a free excerpt of the book available on their website. You just need to go to that link and you can download it. And I don't know if we have time for questions, or are we going to move right on?
You've got a couple of minutes for just questions of clarification before we head into a larger discussion. Any questions of clarification for Steve? I think people are anxious to get onto the big discussion, and I want to introduce Merrell-Ann. So that's great. Thank you. The more I hear, the more I realize how many similarities there are between the village where we work in rural Kenya on the shores of Lake Victoria and the communities that are living right here in Canada. And I'm going to talk to my PhD student after this. I think it would be great for us to bring our community members here to meet with First Nations in Canada. Wouldn't that be awesome? Because they're dealing with the same issues. It's my tremendous pleasure to introduce Merrell-Ann Phare. I haven't met her before, but she's very impressive, and I hope I get to meet with her lots after today. She's a lawyer and the founding executive director of the Centre for Indigenous Environmental Resources, which is a national First Nation charitable environmental organization. She's the author of the book Denying the Source, The Crisis of First Nations Water Rights, and co-author with Robert Sanford of Ethical Water. She's a member of the Forum for Leadership on Water, which is called FLOW, the Water Partners Advisory Committee for the Council of the Federation, and Living Lakes Canada Partners Advisory Committee. She's chief negotiator on behalf of the Northwest Territories in their negotiation of transboundary water agreements in the Mackenzie River Basin, and she's legal counsel and advisor to a number of First Nations and other government and organizations on water matters. Her graduate work in law focused on Indigenous water rights in the context of international trade agreements. It's my great pleasure to introduce Merrell-Ann Phare.
I'm not going to text while I'm talking to you. I'm just setting the timer. So thank you to the Water Institute for inviting me here to speak to you. If you're not thoroughly depressed by all the data and the stuff you've been told already, I'm sure I'll close that circle and get you really bummed out. But I do have a good news story at the end of all this of an example that I think is useful to helping us find a path forward on some of these water issues with First Nations. So I'm going to talk to you about 5 challenges and 1 good news. The first challenge is one you're probably really familiar with, and the other speakers have touched on it a bit, which is basically information, not having enough information in First Nation communities. It focuses on 3 main issues regarding water. One is the lack of, most communities have extensive traditional knowledge about their land and water, but that is frequently not accepted as a valid form of knowledge. In the last 10 years or so, I've seen a big change in people's dialogue about the importance of working with and integrating traditional knowledge, but I hate to say that when it comes to the decision makers who actually have control over whether this is going to get used, like within government or within companies, it's still treated pretty skeptically. And I've seen that just firsthand in the last few years. So I think we have a ways to go yet in terms of accepting and integrating and really working in partnership with their knowledge. The other piece is that you have a pretty piecemeal approach to Western science in communities. Scientists working in partnership, there are really good examples of where that's done, but it's sort of ad hoc. Most communities don't have a comprehensive, long-term approach to getting a baseline data set from Western science, one that focuses on the aquatic ecosystem and the health in general, which is really their source water, right? It's the health of the ecosystem will dictate quite a bit about how much risk they might be at in terms of drinking water or other kinds of water use. The other one is that at the end of the day, most communities don't have a lot of capacity in terms of their own staff, having scientists in the community that can work to analyze the data if they do have it, or the tools, innovative technology that can be used to sort of consolidate all this data and come up with answers that can be provided to decision makers within the community about what is the information telling us, what do we need to do in terms of protecting our source water or our drinking water. It's still pretty patchy. So the second challenge is just about the aquatic ecosystem in general. There's probably and it's mostly true, I think, that many First Nations live in relatively pristine areas of Canada. The problem is that in those areas is also where most of the resource development happens in Canada. So you will have a conflict there, and I hate to say that most of the resource development, I think it's changing a little bit, but most resource development in Canada tends to proceed without a real look at the long-term impacts, particularly post-project impacts on the local community, the Indigenous community that would be right beside there. So you have some really noteworthy cases. If you don't know of them, you can easily find them online, but the Grassy Narrows case, for example, they are downstream of a pulp and paper mill and ended up having Minamata disease, mercury poisoning, extremely, still to this day, many members suffer from that. And that's a really good example of long-term impact that was ignored. The other one would be more recent is Sarnia, the Aamjiwnaang First Nation folks are asserting that their long-term birth ratios are being affected by the chemical mix that's coming out of Chemical Valley. Basically, the Sarnia region is affecting endocrine disruptors and other chemicals are affecting their birth rates. And so I think they're undertaking legal action on that, actually. So those are ways where you can see maybe at the project level, a project went ahead and it seemed like it was fine, but when you add the cumulative effect of all of the projects, you really can start to get some significant effects on the community. And I do think that still we have too much of a thinking, which is these kind of impacts, both on the aquatic ecosystem and on community members, is just sort of part of the long-term cost of doing business, which is really regrettable. I think we need to move away from that and think long-term. There has been a movement towards something called impact benefit agreements, if you're not familiar with those, where companies, with the support of government often, will negotiate a package, basically a financial and kind of opportunities package for communities who are going to be suffering some kind of impact from a development. And that's good. I mean, that's better than not having an impact benefit agreement, but it still presumes that some level of impact is okay and that you can have a financial package that goes along with that and that's okay. And so it's a step in a better direction, but I still think we need to be looking very differently in terms of what are the long-term impacts that we're willing to accept in aquatic ecosystems that surround or that communities are reliant upon. So the third issue that I want to talk about specific to drinking water is the regulatory gap. I'm a lawyer, so I come at it from that perspective, and I think the very first time I presented ever on First Nation drinking water issues was to Steve's expert panel on the First Nation safe drinking water, and that was in 2006. Around that time, I think the drinking water advisories were about 100, 110, about that, across Canada. And one of the things that I argued strongly to the panel at that time was, yes, we need adequate resourcing for proper implementation of and management of drinking water facilities, but we also needed, from the legal perspective, you need a regulatory regime in place. You need rules that mandate people to be able to, that they must achieve a certain standard in terms of drinking water quality. And at that time, there was no law. The rest of Canadians could rely on laws that would provide that, but not First Nations. There was nothing on a reserve that said you have to do this. To the extent that there was anything, it was, as Irving pointed out, it was included in contracts that communities get from sort of funding agreements with government, but nothing that forced anybody, and there were so no penalties for anything. And so I said, we really need to have a binding kind of regulatory regime in place. And the expert panel, I think, heard that from many people and ended up recommending that in December 2006. You need a regulatory regime. So just think about though it took until April, so December 2006, you get a recommendation from the panel saying do this. April 2008, 2 years later, the government begins consultations on a regulatory framework. 2 years after that, in 2010, Senate tables the first bill. It dies on the order table. So almost 2 years after that first tabling, February 2012, you actually get another bill being brought in, and it doesn't get actually enacted into force until November 2013. So you've got 7 years from the beginning of people saying, we need to deal with this, and that wasn't the first time people said it, till the time you actually get a law in place. Now, that is ridiculously long when it comes to safe drinking water. I don't think Canadians would ever tolerate that for, like the rest of Canada, for their own drinking water. And the other challenge with that is that I was very disappointed with the legislation at the end of the day, because it is what's called an enabling piece of legislation. So it really says the government can do this, can create regimes on reserve, can create standards. And the way you do it is by creating a regulation. So that's like a really detailed document that attaches to a law basically and says, here's all the detail of what you have to do in order to achieve this. So in an enabling piece of legislation, you really want to look at the regulations, and you want to see when they're implemented and what do they say and what are they making people do. And that's different than other legislation like the criminal code, which says you can't do this. It's a law. It's right now. It's in effect right now. So there's two different types. And so if you look, what has happened since the law was enacted in November? Nothing. There's no regulation in place yet. So we've got another year and a half, almost 2 years, where you still don't have a regulation. We're coming up on a decade of experts knowing this is a massive issue and it's still not in place. I think work's being done, but it's just completely unacceptable. And now, as Irving pointed out, from that first time I presented in 2006, we now have 139 drinking water advisories. So the number's going up. And I check every year. You can find that number, by the way, if you don't know, on the Health Canada website. Just put in drinking water advisories for First Nations, and you'll be able to track every month or so what they are, and they're just hovering. Nothing is changing. And we shouldn't tolerate that as Canadians, I don't think. So the fourth issue is First Nation rights and water governance. So the main issue here is that my view, legally, is First Nations have water rights that are not acknowledged by most governments in Canada. The Northwest Territories, with whom I work closely, takes a different view. But everywhere else, they basically say, no, the province owns the water. Most legislation actually says the word own the water, or they control it. They have the rights to control it. And that First Nations would be subject to that ownership. Whatever First Nations rights have are only that acknowledged by government. So you can see the fact that First Nations were here first and have extensive rights to land and governance. It doesn't seem to extend, to the extent that governments recognize that, it doesn't extend to water. The problem with that is basically two issues. One is you have governments allocating water, not taking into account First Nation needs. And in some parts of the country, like Alberta, and particularly in the south, governments have over-allocated water. They actually have given out more licenses than the water is in the system, and they have not taken into account First Nation needs at all. So you've got a kind of a time bomb kind of waiting, and when things get really bad, this will come home to roost, I think. The other problem that happens if you don't recognize First Nation water rights is that they don't have a seat at the table then when it comes to water decision making. Rights give you the right to be somewhere and have a say over something. And so take water rights out of the mix, and First Nations have a really difficult time being involved in the choices that are made about how we use water. And that's unfair democratically. Water is a democratic issue, and legally. And the Supreme Court has been dealing with this over the last 10 or 20 years. Like 200 cases have gone through the Supreme Court, close to 200, and they're all pointing in the same direction, which is continually pushing governments and companies that the rights exist. First Nations have valid rights. You need to take them into account. You must consult with them first. You must not impact them, if you do, you have to accommodate their interests. There's a lot of law coming in that direction. It just hasn't dealt with water issues yet, water rights. But when it does, and it will soon, I think, within the next 5 years, I would predict you'll have a case coming out of the Supreme Court on water law, water rights. It will throw our water regime, our water decision-making into chaos, probably. It could completely change. Just think about the reallocation decisions that would have to be made and taking into account the impacts on Indigenous communities. So the fifth one is, when I was introduced, it was mentioned that I wrote a book with Bob Sanford. If any of you know him, you'll probably recognize the word stationarity. He says, does anybody know that? Okay, so stationarity is, it's the concept that seasonal weather and long-term climate conditions fluctuate within a fixed, predictable range. It's basically that the past is a pretty good predictor of the future when it comes to scientific data, right? It tells us we know how much snow is going to come down generally, so we know how strong to build our houses. We know how much wind is going to generally happen in which seasons, and so this is how strong we need to build our buildings and bridges so things don't fall down. And we know how much rain is going to fall in spring, so this is how big our stormwater pipes need to be. And so that idea of stationarity is basically gone. If you read anything Bob has talked about, and he speaks extensively on this, is we've got a significant problem. None of that information is really holding true anymore. You want to talk to anybody to verify this, scientists will agree with this, but the insurance industry, those are the guys who use that data to set our insurance premiums, and they're having a really difficult time saying, wow, we don't have any idea now how to predict our premiums and things because of how significant the patterns seem to be changing. And so the idea here is that if you are in a class of people, a group of people that are vulnerable or more vulnerable, when stationarity, the lack of stationarity impacts you, it's going to impact you more than others. And you heard Irving talk about the particular infrastructure challenges, the challenges of underfunding. All of those things are made worse if you now can no longer predict what the climate is going to do. So this is the vulnerability issue, and the ability to be resilient and to adapt is much more difficult when in First Nation communities. So climate is a huge problem in terms of most Indigenous communities, not only because they're remote and rural and tend to be located in places where climate impacts are being felt more, but also because of the stationarity issue. So, the one success example. I yesterday spoke about a project or initiative I'm involved in with the government of the Northwest Territories over at Wilfrid Laurier we just completed a negotiation, it took about 4 years, with the government of Alberta on a transboundary water agreement. And so those two governments on March 18th signed an agreement. You can get it online if you're interested. It's about 100 pages, including all the appendices, and it's pretty groundbreaking on a couple of key factors, which I'll share with you today, which I think help basically address the issue of Indigenous involvement in decision-making regarding water protection generally, but also the idea of how we work together to protect ecosystems. Because as I said, if ecosystems are protected, you're really talking about a better level of source water. So first, the agreement that we signed was based on a policy direction that had been developed with Indigenous communities, took about 3 or 4 years, Indigenous governments in the North. So it's called the Water Stewardship Strategy, and that's the policy of the Northwest Territories that sets out their long-term water vision. And they did that around 2009, 10, 11, and they created it with the Aboriginal governments in the north, and all signed it, and it sets out this long-term vision. It incorporates the rights that Indigenous people have to water as set out in their land claims, and also this long-term idea of the water needs to be clean, productive, and healthy for all time. So it's got a very long-term goal, and sets it sort of conscribes almost the scale and pace of development in the north. Because it's not that they don't want to do resource development in the Northwest Territories, but they're very concerned about the pace and scale, how fast, whether we're learning as we go, whether we're making the right decisions. And so this water strategy is fundamental to ensuring that discussion happens and that it takes into account water goals. You had in the negotiations themselves, so we started with this water policy, and in the broad action plan for the water policy, it said we have to do an agreement with all the other governments in the north, in the Mackenzie River Basin. We'll start with Alberta, and that was what started the negotiations. In the negotiations, we worked in collaboration with Aboriginal governments at each stage of the negotiations. So we actually had a committee that advised the negotiating team. We had a member on the negotiating team of one of the Aboriginal governments, and we went back with them. We probably did, I don't know how many, dozens, probably close to 100 of different engagement sessions throughout the 4-year period with Aboriginal governments to say, what do you think we should be doing in the negotiations? What do we want? What do we need? And we continually went back and forth. We were the only jurisdiction to do that, of all the jurisdictions that were in negotiations. So it's a more expensive way to do it. It takes more time, more complicated. But at the end of the day, when our agreement was signed, every Aboriginal government in the Northwest Territories supported it. Whereas right now, you have the other jurisdictions figuring out how to try to have Indigenous governments support the agreement. So in that way, we believe we've actually protected many of the rights of the other Indigenous governments in other parts of the Mackenzie River Basin, because our governments, our Indigenous governments, found that the agreement was good for them. The interesting piece is in the north, in Northwest Territories, you have about 80% of the land has settled land claims, so you'll have land claims agreements that have been signed with Aboriginal governments that cover 80% of the territory. The strip just along the bottom, we're at the border between Alberta and NWT, has not yet had land claims signed. And so you have two kind of legal situations. In the land claim agreements, there's a phrase that says the Aboriginal government who signed the land claim is entitled to water that is substantially unaltered as to quality, quantity, and rate of flow. So we had to take that standard into account and say, what is substantially unaltered, and how do we protect this? If the water's coming from Alberta into the NWT, and we're signing an agreement about the quality and quantity of that water, what does that mean? So the rights that have been guaranteed to Indigenous people in their land claims were extremely helpful for us, because we were the downstream jurisdiction. We were able to say, we need a very high quality here. It's a legal requirement. It's constitutionally protected. So we were very happy to work with Indigenous governments on this issue. Not only did we have a legal obligation to do so, but it really helped the negotiations. And Alberta's a tough negotiating partner. You can imagine they're upstream. They've got the oil sands. It wasn't easy. So this was a way, I think most governments and companies look at Aboriginal rights in general as a burden, as a problem. How do we deal with this? Is anything ever going to be good enough? The history is so long, it's complicated. How do we ever talk? How do we build a relationship? I think we were able to do it in this situation. We have integrated into the agreement traditional knowledge. There's an entire appendix dealing with how we're going to learn and work with Indigenous knowledge in implementing the water management agreement. And Alberta agreed to that. And so I think they don't have a lot of experience in how to do that, but they're willing to learn. NWT has much more experience with that because of the long involvement of Indigenous communities in the decision making there. But we are actually bringing Indigenous people to the collaborative discussions we're going to have and integrating their knowledge. The final piece that I wanted to mention about this is that at the end of the day, probably the most important thing about the whole agreement is that it's not actually a water agreement, even though that's what the title says. It's actually an aquatic ecosystem agreement. When we first started talking, the idea was, by other folks, not us, that it's a water, the way you manage water is you manage quality and you manage quantity. That's all. That's the only thing humans can do. And we said it's much broader than that. It's about the whole aquatic ecosystem, all elements of the ecosystem. We have to ensure that everything is healthy. It's an integrated part. We are part of it. And we ended up having that standard be the standard in the agreement. So the agreement is supposed to maintain the ecological integrity of the aquatic ecosystem. So you just think about the words maintain. That means it doesn't get any worse than it is. In fact, could get better. Ecological integrity, so it's the interconnected pieces, how they work together, that it's an ecological system, has to have integrity. And it's the aquatic ecosystem, it's all pieces. And so the other piece related to that is that we agreed that in implementing the agreement, the fundamental standard would be that the ecological needs are met first, and that humans take what's left over, if there's anything left over. So you think about how much water you can take, pollutants that you can put in. You have to ensure that ecological integrity is maintained. Their needs are first, and then we take. So that's only been done one other time in the world. That standard has never ever been agreed to, and that was in the Murray-Darling Basin. And they weren't successful in maintaining that on the water quantity side because the droughts were really significant. But Alberta and NWT are going to be the jurisdictions that actually get it done. We're going to stick with that. So with that, that's my presentation. Thank you very much for listening.
Come and sit at the front. Thanks very much, Merrell-Ann. I'm going to take the privilege of chair, but I'm going to check in with Kevin. We have 30 minutes for coffee break, and both the follow-up sessions are in this building, so we don't have to go very far. So I'm wondering if you would mind if I cut in 5 or so minutes into the coffee break to allow a great discussion to happen. So we've had 3 tremendous presentations. I'm going to open it up now for broad discussion. Questions for any of our panelists or all of our panelists? Who wants to be first? Go ahead.
Yes, Peter from Years Water. I'm ready for Steve and maybe I think Elliott, basically I work in water treatment areas, and basically in some of the context, but I had the opportunity about 10 years ago to visit First Nations community northern part of the Phare provinces to look at their water systems. And what struck me was that obviously it was a remote community, relatively small, that what I was seeing was what I would call southern technology. So a fairly highly mechanical plant. If you needed a spare part, you couldn't get in town. It was going to have to be brought in from somewhere. I'm just wondering, going forward, is there a sense in terms of the, I guess, the capital funding to try to design things that are, I guess, more robust, perhaps simpler technology, although the capital cost may be somewhat higher to, and this gets into the operational issue that you were talking about, Steve. So is there that kind of thinking or
So can I just paraphrase the question for the purpose of the video? I think what you're asking about is the use of appropriate technology, which may in fact require a larger capital investment, but might be more sustainable in the long run, as opposed to, yeah, good.
Thanks. Good question, Peter. I think that is the one of the reasons why AFN and I've agreed to work with the research organizations, CWN and WaterNet, to look at those developing, as you say, innovative systems that are going to be robust and I don't think it necessarily means like something like a tank and run over it, that type of thing. It's going to be something that's going to be easily used, easily adaptable, And I don't want to take anything away from our operators. I think many times our operators or funding agencies may recognize the capacity that we're developing with the operators. They're becoming more knowledgeable. They're meeting the education standards that the operator needs, so they're able to run some of these higher class 3 systems. So that's not to take away that if you give our operators a complicated system that they're not able to operate it. But I think in the long run, if it's more simpler, it's better for everybody. So that's one of the things that we're stressing, that let's develop those small innovative systems that are applicable and useful in small communities. So yeah, you're absolutely right there. Thank you.
Did you want to add something?
And I was thinking more of the dependence on a whole bunch of mechanical parts that aren't really available locally. I was thinking more of that than the operator.
Yeah, and you made that sad. So yeah, it is. So it is a problem, particularly with remote communities. We did have one situation where a small membrane-based system was installed in the northern community, and it was provided by a well-known company. I won't mention the name, but when it came to replacing the parts, they couldn't do it, and that system had to be taken out and brought in by a more locally based system. So it is something to look at.
Did you want to add something, Steve?
Yeah, I just add that, I mean, I think it's an excellent point, and the resolution highlights the nature of a stress system, in that the funding for capital investments is always inadequate given demands, and the people holding the purse strings are stressed on many fronts, and so looking at how efficient the investments are, and is there a better way to make them effective, I don't think has come to the top of the heap. So typically the system it's a procurement system that replicates other government procurement systems, and it's not really attuned to saying, is there a better approach? So I mean, you make an excellent point, and ultimately the sustainability of any of these small systems would be much better if we used a bit of imagination.
Thank you. There's a question here. Yeah.
Yeah, my question is from Merrell-Ann. You mentioned that you did about 100 engagement sessions in the process of your negotiations. I was wondering if you could give us an example of maybe how an issue, the frame on an issue was shifted by one of these engagement sessions, or something you learned from the engagement sessions that changed how you negotiate.
So I'm just going to repeat the question. In all of your negotiation sessions, again, I'm going to rephrase, you tell me if I'm doing it wrong, but was there a tipping point at any stage where things started to look different, or what were the learnings from those engagement sessions that made things happen differently beyond that point? I use tipping point because of our link to Malcolm Gladwell at the University of Waterloo.
Sure. Well, there's a whole list of them, and they're sort of small bits, but a really good example is just we needed backup from all the folks in the NWT to push both two things, the involvement of Indigenous people in the implementation of the agreement over time. The governments were seeing it really, well, one government was seeing it really as it's government to government, and that doesn't include Aboriginal governments. And so we had to say, every single Aboriginal government in the Northwest Territories is not going to support this agreement, and it will not get signed unless they have a role in implementation. They need to sit on the committee that's going to be created between our two governments, and they have to have their own voice there. And so, and when we asserted that, it didn't carry as much weight as when we could rely on the fact that every single government we had talked to had said that. Similarly, traditional knowledge was another one. I mentioned the resistance to this. And so we worked with communities to help articulate the way we would actually write the appendix, like what's actually in it that could adequately scope out what traditional knowledge is and how we could figure it out over time, because that's the big thing with it, right? Is it's a continual process of how do we work together with this knowledge? How do we talk about it? How does it affect decisions? It's not something that's static. And so saying to Indigenous governments, what kind of language would you be comfortable with that you felt is the knowledge is being treated fully and respectfully, but allows us to grow over time? So there's 2 examples, and many on the actual fish, bugs, quality, quantity side, tons of information on that about what was a good enough standard to accept.
Yeah, question at the back, yeah.
Phil Dick from the Ministry of Agriculture, Food and Rural Affairs here in the province. I work with the food industry on water and sewer issues, and we're working with some technologies that are both low cost, low tech, and easy to manage. And Irving, I think it may be worth a conversation because the scale of the technology that we're looking at is similar to a small community. And maybe we can have a discussion offline.
Could I make one comment?
Absolutely.
And it sort of relates to the technology piece also. In the organization I worked for, we did a study maybe 15 years ago on the use of alternate technology like composting technology, sewage composting for communities, individual units. And what we found at that time is that it wasn't so much about actual technology. It was about the willingness of government to accept risk in trying something different, right? It's because you have long-term data that says this system gives this level of health effect, you get rid of these bacteria, whatever, but if you try something new, we're going into a potential, is this as safe? We're not sure. And that was directly told to me in our study by the federal government.
And that is something that we're doing with these technologies, that we're working with different agencies to make sure that kind of question is answered.
I'd like to add to that. And supporting what Marilyn is saying on the funding side. We also, probably as everybody knows, the inertia with the consulting companies. They're quite happy to continue doing what they've been doing before, and it's awesome. Also a lot of effort involved to get them to look at other technologies that have come up, mainly because they're just not comfortable with it. They're comfortable where they are, so that's the other aspect to that.
I'm going to take a question from Rob, and then I'm going to take one more question after that. So if you have, okay, so you'll be next, and you'll be last before the break. Go ahead, Rob.
Merrell-Ann, I was so happy that you ended with a positive example and that story in particular. I'm wondering, Bing and Steve, I mean, you guys have tremendous experience, boots on the ground. Can you share a similar positive example from your work and your experiences where a community has really found a way despite all of the challenges, or it's a success story? Do you have one of those you could share with us as well?
So the question is to Merrell. Merrell provided a positive example at the end of her talk. Do Bing and Steve have positive examples that they can share?
I'll try. Yeah, sometimes we tend to focus on the negative side of things, and there are some positive stories of communities that have moved forward, have addressed their water systems, but most of them are in the south, what we call the south. We know that the communities that are in the north are the ones that have the most drinking water advisories, but I think the good news story to that is that capacity or good story is slowly moving northward, where we find the least drinking water advisories in the communities in south close to urban centers or in the drivable areas. So I think we're chipping away or chomping away at that problem, but slowly moving it forward. It's the remoteness that we have to overcome. But good news stories in the south.
Steve?
Yeah, I have to test my aging memory cells here, because this was a story we heard in our public hearings back in 2006, but I believe it was the Piikani First Nation in southern Alberta were telling us about the challenges they had in retaining their water operators because of the oil sands boom, that they were finding that their operators were offered a lot more money to go up and work in Fort McMurray. But the attitude of the supervisor who came to testify at the public hearing was, hey, this is a good news story. I mean, you know, we have still have unemployment issues on reserve, and they found that they were able to train their people up to a standard where they were in demand other places, and they didn't have the fanciest water system or anything like that, but by investing in the people and the training, they were actually dealing with a social issue as well.
Thank you. One more question.
This question is for any of you or all of you. There was a lot of talk about negotiations or consultations or cooperation between First Nations and non-First Nations people. So my question is about the water ethics or the water worldviews or the basic human relationship with water, and how that's different between First Nations and non-First Nations people, and the learnings that you've learned through your experiences of the challenges and the opportunities of understanding the difference of worldviews and ethics related to water.
So we're going to end with a very small question to the entire panel on perceptions of differences between worldviews, ethics, relationships, human relationships with water between First Nations and non-First Nations, or Aboriginal peoples versus non-Aboriginal peoples. Who would like to challenge that in about 30 seconds? Because that's about 4 PhD dissertations.
I'll say a little bit, but I'll leave most of it to Merrell-Ann. In my experience, starting to work with, especially at the Assembly of First Nations, one of the things I've been pleased with is the, I think the understanding of the worldviews on both sides, and the involvement of NGOs and other organizations, in particular, most recently, the Freshwater Alliance activities, where that understanding of First Nations beliefs and spirituality of water is becoming to be understood. One of the other areas that I think I would like to commend Canadian Water Network for beginning to understand is starting to involve elders in water ceremonies at their major events. I think that's a great positive step forward, where the research, academia, and those people who are involved with doing are beginning to see that, yes, we have to involve First Nations whenever we talk about water. So I think that's a positive step forward in terms of, especially, I think, educating young students, young researchers in that kind of, as you say, ethic, and begin to understand what our values are, and sometimes we even see it a lot more of them taking up those values. So I think that's been positive.
So, if you know Aboriginal people who practice traditional ways of life and are very connected to their traditional worldviews, it's very common to hear them say not only is water significant for life, but that it's alive. It actually has its own spirit. And so that is not, it's unique, but it's not completely unusual. Other cultures in the world believe water has a very significant role spiritually in many cultural processes, and so I don't think that necessarily we're that different. And at a very human level, regardless of whether we're Aboriginal or not, I think everybody knows that and believes that water is very important to protect and to deal with. Where I see the difference in sort of an ethical relationship is regarding things not related to water but that affect water, like economic development. I think some of that you would see, generally speaking, not meaning to overgeneralize, but a more of a commitment to pace and scale of economic development and more a fast pace and scale and more of a commitment to like a willingness to accept some impacts in non-Aboriginal community than you might in Aboriginal community. And it's not 100%, because there are definitely First Nations and Métis communities that are interested in a lot of economic development. But I just think as a generalization, you would probably see more of a willingness to slow things down a bit, make decisions that take into account the impacts on water than you might see in non-Aboriginal communities. That's the conflict. That's usually where the values come into conflict, is when is enough enough, right? Like, when do we say no? And that's where, and how you weigh in on that decision affects water.
Okay, I guess I'll provide a slightly contrarian view in the sense that I think there's common ground between Aboriginal and non-Aboriginal communities commonly now to look at nature and natural as being good intrinsically. And I don't debate that at one level, but as a professional engineer, my code of ethics puts preeminence to public safety, and when it comes to drinking water, public safety means safe water. And unfortunately, the reality is that fecal waste is all natural. And if you want to have safe drinking water, you have to treat it. And that if that offends somebody's view of what's natural, then I'm going to have a tough time meeting my ethical obligation to provide you with safe water.
That's a very good note to end on. So we'll wrap up here. I want to leave with a comment and a question to our panelists for them to ponder. My comment is, as a water health researcher who works primarily in rural East Africa, this morning it's just been underscored for me over and over again the parallels between our Aboriginal people's experiences and those in rural Africa. And the science policy bridging piece is really, really important to me, and I always like to plug the work of my graduate students. So my PhD student, Elijah Bissong, actually has a paper called Usoma's Journey, which is how this community overcame financial, political, physical challenges to actually end up with water and sanitation in their community. And it's a very good paper, I have to say. The question I would leave with our panelists to ponder throughout the day is, Irving, you talked about the need for meaningful relationships with academic groups, and you talked about the Great Canadian Water Network, which of course is coming to an end very soon because it's a National Centre of Excellence. Their funding will end. But here at the University of Waterloo, as Bob pointed out in the introductory comments, there are 140 water researchers at this university. And I can't see Mark at the moment. Mark Service, who's the director of the Collaborative Water Program. How many graduate students are involved at the University of Waterloo in water research? It's got to be hundreds and hundreds. Hundreds. About 400 graduate students who are all looking for meaningful projects to work on. So what I'd like the panel to think about is, what can the Water Institute do to support your needs for filling in knowledge gaps, for filling in research gaps? And this tremendous labor pool of graduate students who are so keen and who are looking for projects that are not just going to give them PhD dissertations or master's theses and publications, but they want to make a difference in the world. So this is a tremendous resource, and I hope that you'll think about how you can continue a relationship with this resource. So I apologize, I've cut into your coffee break time, but you still have 15 minutes to grab a coffee and a snack. And both of the follow-up sessions are in this building, so you don't even have to go outside, although you can go outside because I hear it's going to be a beautiful day. But you should be able to get to your next session. Thanks so much to our speakers and to everyone for coming.